Hello, I'm Leslie Craig, Public Health Advisor for the U.S. Department of Health and Human Services in the Region 5 Office of the Assistant Secretary for Health. Region 5 covers the 6 Great Lakes states of Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. On behalf of my office and my partners, the Adolescent Health Initiative, thank you all for joining us for today's webinar, Adolescent Brain Development, Enhance Your Approach to Working with Teens. We know that brain development continues into the 20s, a time in which many important developmental and social changes occur in a young person's life. Today's session will discuss how adolescent brain development impacts interactions between teen patients and healthcare professionals. Before we begin, I'd like to draw your attention to some important webinar logistics. Today's webinar is being recorded, and you are currently in a listen-only mode. Use the question box to chat in your responses to prompts during the webinar. If your dashboard is minimized, use the orange arrow to expand it. You may also send questions at any time during the webinar. Simply type your question into the question box to the right of your screen and send it to the organizer. We will designate a time at the end of the webinar to answer as many of your questions as time allows. A link to the audio recording of the entire webinar will be sent via email next week. About this time 2 years ago, our Region 5 office established a regional adolescent health network. The regional network addresses a myriad of adolescent health issues, and we've designed this year's programming to focus on topics related to adolescent mental health and well-being. This slide includes details on how you can sign up for our email listserv to receive our updates. Our next programs, taking place in March, are listed here. Feel free to contact me or sign up for our listserv for more details. I would also like to acknowledge our sister agency, the HHS Office of Adolescent Health. OAH leads the Adolescent Health Think, Act, Grow, or TAG, a national call to action that aims to raise awareness about the importance of adolescent health, engage stakeholders, get adolescent health on the national agenda, and to spur action through a comprehensive, strengths-based approach. Learn more about the Office of Adolescent Health and TAG by visiting their website and signing up for their e-updates. Lastly, I'd also like to highlight the Adolescent Brain Cognitive Development, or ABCD study, the largest long-term study of brain development and child health in the United States, which is currently recruiting approximately 10,000 children ages 9 through 10 to study trajectories of change throughout adolescence. The National Institutes of Health, or NIH, funded leading researchers in the fields of adolescent development and neuroscience to conduct this ambitious project. The study tracks biological and behavioral development in adolescence and into young adulthood. Through use of cutting-edge technology, scientists will determine how childhood experiences such as sports, video games, social media, unhealthy sleep patterns, and smoking interact with each other and with a child's changing biology to affect brain development and social, behavioral, academic health, and other outcomes. More than 7,500 youth and their families have been recruited for the study, well over half the participant goal, and last month the NIH released the first data set of high-quality baseline data obtained from the first 4,500 participants for scientists to access for free around the world. Learn more about this unprecedented study of the adolescent brain development at abcdstudy.org. Please know that the content and views contained in these presentations do not necessarily represent the official policies of the Office of the Assistant Secretary for Health or the U.S. Department of Health and Human Services. I'd like to thank each of you, our participants here in Region 5 and across the country, for joining us for today's webinar. I'd now like to welcome our presenters from the Adolescent Health Initiative, Lauren Rinaldi, AHI Director, and AHI Program Coordinator, Asia Thompson.
Hi, everyone. Thank you so much, Leslie. This is Lauren Rinaldi
and Asia Thompson.
And thanks for joining us today for our training on adolescent brain development, enhancing your approach to working with teens. The Adolescent Health Initiative is based out of the University of Michigan, but we work with a national audience of providers and healthcare professionals to provide training and technical assistance and coaching to improve adolescent-centered care and improve adolescent health outcomes. Here is what you can expect from today's training. We are going to share some information on AHI's SPARK training model. Then we're going to take you through a SPARK training on adolescent brain development. Next, we'll share how you can deliver this again at your own clinic or organization. And finally, we'll share some additional resources with you on providing youth-friendly services. Let's go ahead and get started. So AHI developed SPARK to meet the needs of health centers and youth-serving organizations across the country. We know that these organizations and clinics have limited time for staff training, but that they're interested in improving the youth-friendliness of their organization. AHI currently has a menu of 8 SPARK trainings, and they're all available for you to use and download directly from our website. Each SPARK comes in a version designed for clinical or a non-clinical audience, so they can be facilitated in your own health center or organizations, shared with community partners, or used for partnership building professional development opportunities. So today we're going to show you an example of a clinical SPARK. What exactly is a SPARK? It's a mini training that can be delivered in 15 to 30 minutes, and it's meant to spark reflection, conversation, and behavior change. SPARKs include ready-to-use PowerPoint presentations, scripts, and accompanying materials so that they are ready to be used and presented with very little preparation. SPARKs are typically facilitated by 1 to 2 individuals within an organization for the rest of the organization's staff. Since SPARKs are so short in length, they're accompanied by sparklers, which are short activities that can be posted in your organization throughout the month to keep that particular topic on everyone's mind. Sparklers may be case scenarios, youth quotes, or quizzes. The content we're going to present today on adolescent brain development is going to be delivered in the form of a modified SPARK training. For this demonstration, Asia is going to be in the role of the facilitator, and I'd like us to all imagine that we are at a staff meeting together. So please use the question box feature to participate in the brief activities as if you were an actual participant in the meeting. A final note, the SPARK consists of a script, which Asia is mostly going to follow so that you can get a feel for it, but she'll also provide you with some prompts and suggestions of how you might facilitate this on your own. Now I'm going to turn it over to Asia.
Great. Thanks, Lauren. So as Lauren mentioned, for the sake of today's webinar SPARK format, we are going to change some of what would normally be verbal discussion question prompts to question box and reflection questions, where we'll give you a few moments to reflect to yourself on prompts or to go ahead and type your thoughts in. So I will make sure to let you guys know when you need to locate your question box to go ahead and respond to our prompts. So today we are going to do a 15-minute mini training, also called a SPARK. We'll be looking at the basics of what research tells us about adolescent brain development and how that plays out in a clinical setting. We'll also be thinking about what makes it challenging to be sensitive to teens' needs. To help us think about what this means in our day-to-day work, here's a scenario that may seem familiar. You work at the front desk. 16-year-old Shayla is 10 minutes late for her appointment, and she comes up to the front desk to check in. She does not look up at you, but instead, she stands at the desk and appears to be texting. In an upbeat voice, you say, "Hello, do you have an appointment?" She continues to look at her phone, frowns, and keeps texting while you wait. Finally, she looks up and says, "What?" We'll come back to this scenario in a few minutes, but for now, consider your gut response to this situation. In a clinical setting, our first impression of a patient is usually based on nonverbal cues. In the moments before we interact with them, let's look at some of the forms of nonverbal messages and think about what teens might convey. Facial expressions could be positive and open, or could convey fear, reluctance to talk, or anger. Some teens avoid eye contact or even roll their eyes. Personal space might look like someone getting too close or withdrawing or pulling back. Hand gestures and posture can convey many things. People often think that crossed arms conveys being closed off, frustrated, or annoyed, but there could be another explanation. It's common to make assumptions about communication cues, especially when working with teens. This can show us when we have biases. So now we want to hear more about the interactions that you have with adolescents. Let's move into a question box discussion. Please locate the question box on your dashboard and answer the following question. What are some adolescent behaviors or characteristics that could be seen as positive? Lauren will assist me in reading 4 or 5 responses from each question before moving on to the next prompt. So again, if you could go ahead and locate your question box, try to go ahead and give us a response to this question. What are some adolescent behaviors or characteristics that could be seen as positive that you've experienced in your day-to-day work?
Yep, we're seeing that adolescents they're energetic, they're smiling, making eye contact, laughing when appropriate, exuberant, good hygiene, someone says, talkative and energetic, greeting adults with a smile. Yep, exactly. Eye contact, asking for questions. They're curious, have good manners. A handshake or a high five.
Okay, great. Okay, so now we're going to move on to the next prompt. On the other side of this question, what are some adolescent behaviors that could be seen as frustrating?
Yep, no eye contact or rolling their eyes, argumentative, lack of engagement, crossed arms. Yeah, seeing lots of eye rolling on here. Being rude on their phone, uninterested, no-shows, seeming withdrawn, ignoring you, breaking the rules, shutting down, not paying attention. Yep, definitely seeing a lot of focus on their phone. Maybe their tone of voice, one-word answers, sleeping while you're teaching. That would feel disrespectful or frustrating, but may have another explanation. Arguing with a parent, speaks very low, defiant behavior, walking away when you're talking to them. Yep, these are great responses.
Okay. All right. So for our next prompt, just take a moment and reflect on it in your mind. So you don't have to type anything into the question box at this point. We just want to try to get you guys' frame of mind for the next one. So think about some adolescent behaviors or characteristics that you notice the most in a clinical setting. So it could be any of the ones that you've already mentioned. Just try to get a couple of those in your mind. Any adolescent behaviors or characteristics that you notice the most in your day-to-day work. So out of those that you considered in your mind, let's have you guys type into the question box the ones that you find the most challenging, adolescent behaviors that you find the most challenging in your day-to-day work.
Resistance and mistrust, being withdrawn or distracted on their phones, total shutdown. You have a lot of people writing about phone use, side talking with friends, lack of engagement, not participating, not paying attention, kind of a refusal or a reluctance to speak, and maybe interrupting others, trying to impress their peers. Failure to think about the future, feeling entitled, aggressive behavior, shouting, criticism, being kind of sneaky or hiding, not responding. I'm saying toxic masculinity among teen boys. Great, thank you. These are great responses.
Okay, and then now let's talk about some of the ones that you find the most rewarding in your day-to-day work. Which adolescent behavior make you feel the most rewarded from day to day?
They're thankful or having an aha moment, a passion for justice, laughing, sharing positive stories. They're smiling and their appreciation, their engagement, curiosity when they ask questions or they're willing to engage, have a good conversation. When they say that your class was inspiring, so you're getting positive feedback from them, evidence that they want change, they're asking for help, they want to hang around longer and to speak with you, they want to take ownership, and they start thinking about the future, and they express empathy, they're motivated. Great, thank you so much.
All right, thanks guys. These are all great reflections to keep in mind about the adolescent behaviors that we notice in clinical settings. Adolescence is an essential stage of life, and its developmental characteristics are a natural part of the way the brain is changing. Even if we know that teens will be teens and adolescence is an important phase of development, it can still be challenging to work with teens. Some people love working with them, some don't. Either way, understanding what's going on for them can help us be respectful and give them the care they need so they'll keep coming back to us. Let's review some of the ways that clinics and other youth-serving organizations could try to be respectful of the developmental needs of adolescents. So just a few thoughts. Because the right to confidentiality is an important need for adolescents, clinics may post adolescent confidentiality rights posters. Clinics may also add new health education materials chosen by a teen advisory council. Providers might try to avoid using medical jargon to explain things to teen patients. And finally, clinics may do risk assessment surveys with more teen patients, so providers can learn more about the needs of individual teen patients and address any risky behaviors. Functional MRI has shown us how the brain develops from age 5 to age 20. There are significant changes that occur during the period of adolescence, with some parts, like the prefrontal cortex, not fully maturing until the mid-20s. In the front of the brain is the prefrontal cortex, which is the part that controls complex decision-making, judgment, and understanding cause and effect. At the same time that the prefrontal cortex is developing, the limbic system, which is in the middle of the brain, is highly active. That is the reward center and controls emotion. As part of their development, many adolescents crave novelty and seek new experiences. The combination of these developmental characteristics can result in behaviors that can be really challenging for both adults and teens. Also, the need for peer acceptance is at its peak, and many teens seek excitement through risk behaviors. Sometimes they don't always have an accurate perception of the consequences of their behaviors, like using alcohol, drugs, and having unprotected sex. Also, most teens are focused more on themselves and their needs than they are on others. These are all normal and developmentally appropriate when we consider the way the brain is changing. It can be hard to remember that this process is normal for teens. When a toddler has a tantrum, our first reaction might be irritation, but usually our adult brain kicks in and reminds us that they are probably hungry or they just need a nap, and this behavior is normal for a child. Often, though, when we interact with teens and see negative behaviors that can be challenging or annoying, we forget the developmental explanation for these behaviors. Considering this, what can we do to adjust our behaviors or reactions to give teens the patience and respect that they need? It's up to us as adults to help them along the way, and it's what we have to do to be truly patient-centered. Let's look at some scenarios to think more specifically about how we can do this. First, we will revisit Shayla's scenario on the screen together. Here in the first column is the scenario description. To summarize, Shayla was late to her appointment and then was texting while the receptionist was asking her if she had an appointment. So let's move to the next column where it says gut feeling. Think about what your gut reaction to this might be. So some of your thoughts as we've listed here may include that you might feel annoyed or mad. Next, think about what negative assumptions you may have. Sometimes, without consciously thinking about it, we create a quick story in our heads about why someone is behaving a certain way. In this case, we might think to ourselves, I bet she's texting a friend about something unimportant, and she's rude to ignore me. Here's where we need to rewrite the story and imagine other possible reasons Shayla is behaving as she is. One possibility is that she was late because she had to take a bus to get here, and the bus was running late. When she walked to the front desk, she frowned when she got a text from her mother saying that she needed to get home as soon as possible to watch her younger brother. Developmentally, she might be tuned into her own needs more than the receptionist, so she is distracted by her text and doesn't reply right away. Now, this situation still might be frustrating, and the text could also really have been from a friend about something trivial, but it can help us give teens the benefit of the doubt and not let our gut feeling control our reaction to the teen. So next what we're going to do is we're going to close out this spark with some discussion about another scenario. I'd like for everyone to again locate the question box on your webinar dashboard. First, I'm going to read the scenario. Next, I'd like for everyone to type in their gut feelings to the scenario into the questions box. And again, Lauren and I will read a few of the responses before moving on. Darren's wearing saggy pants, and his shirt says, "Please tell your boobs to stop staring at my eyes." His mother is standing next to him. When you ask him a question, he shrugs and grunts. His mother says, "Darren, they're talking to you. Speak up." Then she turns to you and says, "Can you please tell my son that he needs to answer you and respect adults?" So everyone, please type your gut reaction into the question box.
All right, so you might feel annoyed, frustrated, disrespectful, kind of some mixed feelings, kind of in a bad mood. Mother's not parenting her child. Tough one with mom, it's a rude kid. Might be embarrassed because mom is there. Maybe it's bad parenting. You tell him yourself. Might be something you want to say to the mom. Yep. Feel defenses for Darren, feel annoyed or uncomfortable. Poor mom, challenging kid, sounds really disrespectful. Or you might feel bad for Darren. Yep, gut feeling is that there's a disconnection between the parent and the child. What might be causing this? Maybe they're just having a rough day. All right, great, thank you.
So next, let's move into some negative assumptions from this interaction.
So what are some of the negative things you might assume? Right, maybe you're assuming that the mom isn't parenting or that this is poor parenting. Maybe that the mom has lost control of her son. Maybe that he has no manners. Maybe that he's always this disrespectful. They have a poor relationship. Right, you might think that Darren is misogynistic. You might think the mom is struggling. You might assume it's a strained relationship. You might think that Darren doesn't respect women. You might think they have a dysfunctional family. You might wonder if he's using drugs or alcohol. Yep, a number of people saying wondering if he doesn't respect women or girls based on his shirt. You might wonder if the dad's in the picture.
Awesome. Great responses. So lastly, let's think about how we can rewrite the story and think about some other possible reasons why Darren and even his mom might be behaving this way. Go ahead and type those thoughts into the question box.
Maybe they argued before arriving. Maybe his shirt was a hand-me-down. Maybe he was forced to come. Maybe he's embarrassed that this is the only shirt he had to wear, or that is could have brought another one. Maybe he's hungry. Maybe he has social anxiety. Maybe he doesn't have any other clean clothes to wear. Maybe they didn't eat this morning or they didn't sleep well last night. Maybe he's shy. Maybe he's irritated with mom or he's trying to get a reaction. Maybe he's being bullied. Maybe he's really anxious about coming in for treatment. Maybe he's shy and an introvert and just doesn't understand why he's there. He could be nervous. Maybe his mom has a lot on her plate. Maybe he thinks his shirt is just a shirt and he likes it and he doesn't, think anything of it. Maybe he's embarrassed to be there with his mom. And maybe he just didn't want to come. Maybe he's never had positive male role models. Great, thank you. Excellent responses.
Yes, thank you. So hopefully today's discussion has sparked some ideas on how we can all be more patient-centered with our teen patients and meet their developmental needs. To keep this conversation going over the next month, I will share sparklers or case scenarios that relate to adolescent brain development. I'll post the sparklers around the office in places that you can all easily see them. When you see a sparkler, take a moment to read the scenario and think through the questions listed on the page. Thank you for your participation.
All right, so now that we've modeled a spark for you, we're going to spend a few minutes diving into the spark model. So all sparks follow the same outline. The hook is what emotionally draws someone into the topic. Key concepts introduce the content, and the application and sparklers give participants ideas on how to put what they've learned into action. So for this spark we just did, the hook was the case scenario discussion. We introduced key concepts through the talking points around brain development and developmentally appropriate behaviors. And the Beyond Gut Behavior section was the application portion. And so this is really meant to give you an introduction and some tools and resources that you can take back to your team to start thinking more about how adolescent brain development and appropriate behaviors, developmentally appropriate behaviors, might be influencing your interactions with teen patients. Now that you know what sparks are, let's talk about how to effectively deliver one in your organization. So the good thing is you don't need to be a seasoned public speaker or a content expert to deliver a spark. What you do need to be is a facilitator. So using the question box, can anyone share what qualities you think make for an effective facilitator? They ask good questions. They're engaging, they're quick thinking, they have an agenda. Maybe they also stick to their agenda or they're flexible with their agenda. Have humor, eye contact, they let the group talk, they listen well, they have ways to engage participants, right? They're conscious of time, they're personable, they're open to what people have to say, they can be motivating and engaging, they adapt to multiple learning styles, entertaining, they can redirect when necessary, they're prepared for their presentation. Agreed. All right. Thank you, great responses. So I agree. I think that being timely, watching a schedule, adapting to groups' needs, clear communication, preparation, having a sense of humor, that they care about the topic or the participants, and they're encouraging. So as you can see from the slide, to facilitate means to make easier, meaning we create a safe and supportive space for people to work together and learn by providing a structure for learning. So facilitator is a person who effectively and efficiently guides without directing, brings about change without disruption, and assists people in groups in constructing their own learning. So this is designed to be delivered by a facilitator rather than a presenter. So the spark on adolescent brain development is meant to be conversational and spark dialogue rather than being focused on transferring knowledge from the presenter to the audience. Let's keep that in mind as we move forward. So thinking about adult learning principles. So adult learners, they need to know what they need to know. They have a deep need to be self-directing. They have a deep reservoir of experience that is a rich resource for learning, both for themselves and for others. They become motivated to learn something when they experience a need to learn it in order to cope with real-life events, interests, or problems. And they attach more meaning to learning they gain from the experience, when they gain something from the experience than those they acquire passively. So they prefer to be problem-solving over subject-centered learning. So using your question box, type in, a number. Do any of these kind of jump out at you or resonate with you in terms of what do you feel when you're an adult learner, when you're in part of a presentation? You can just type in the numbers. Okay, so seeing a lot of 4s and 5s, right, that these things feel more meaningful if you can actually relate to them, if you've got sort of an emerging scenario or issue in your life, feels like you're more connected to the content, more invested. Yep, seeing a bunch of 2s as well, have a deep need to be self-directing. Yep, exactly. Great, thank you. So when facilitating a Spark on adolescent brain development or another content area, think about which of those adult learning principles might also resonate with your staff and how you can use these principles to effectively provide professional development opportunities. So some examples might include providing background or rationale for the topic. For example, are there situations or scenarios going on in your health center or your organization right now where adolescent brain development feels like a pressing need? Why is this the topic that you've chosen? You might want to include interactive conversation prompts, such as the ones that we've provided today, or have opportunities for participants to share their own experiences and expertise. So these are really meant to be sort of an overview to prompt discussion, but do you want to have additional experts who are there who can provide some more content? So when you download the Spark from AHI's website, you will get the PowerPoint slides, the facilitator script, the participant handouts, and the sparklers, which are the follow-up activities that can be shared throughout the month. So on this slide, we have a portion of the Spark script. So at the top, you're going to see what supplies you'll need for the Spark. And this often includes like projector, laptop, speakers, copies of any of the handouts to go along with the Spark, just to be sure that you're prepared before presenting. You'll see that the script clearly notifies you when you need to switch slides with the computer icon and slide title. And Spark scripts are already written in a conversational tone, but occasionally, though, you'll see blue text providing the facilitator with instructions or prompting you to include personal stories. So the goal of the script is to make it as easy as possible to use, requiring very little time or preparation on the part of the facilitator. And so this adolescent brain development Spark that we've included today, it also comes with an informational video from Frontline that has some experts on adolescent brain development who are speaking. So when you download it from the site, you will get that content expertise as well. This is an example of the sparklers. So this is another scenario that you could post in your health center or in your organization, maybe in a break room or kind of, in some common areas so that people can continue the discussion after your presentation. So here's an example. Jada is 15 and being seen because her mother wants her to begin birth control. Since her mother found out that Jada has been having sex, every time you talk to her, Jada starts laughing. At first, you just repeat what you say so she can hear you, but she keeps laughing, which makes it hard for you to communicate her. So you and your colleagues and others, that you're working with can think about, what is your gut feeling for this scenario? What are the negative assumptions do you think adults might have about this teen's behavior? And then finally, what are some alternative explanations that might be there? Or what developmental characteristics might be at work? So this is another opportunity to sort of keep conversation going and continue to think about how adolescent brain development and developmentally appropriate behaviors really affect our interactions and our assumptions about working with teens. So now that you know the background for Sparks and you've seen one in action, what's next? So one thing you could do is you could take a look at all of the topics that are available to you on AHI's website to see what might be a good fit for your community. So in addition to the adolescent brain development Spark you participated in today, AHI has created Sparks on being youth-friendly, confidentiality best practices, being an askable adult, strengths-based approaches to adolescent sexual health, non-judgmental communication bias, and other topics. So next, think about your setting. So Sparks can be facilitated in a health center with the entire practice team, everyone from front desk staff, medical assistants, social workers, physicians, and so on, anyone who interacts with patients. They can also be used for professional development opportunities with community partners. So you can share the format with them or offer to facilitate a Spark in their setting. And we've helped organizations host Spark train-the-trainer sessions for partners in their community. So if there's a need with communities in your setting or with school systems or other health practitioners, there's a lot of different ways that you can use this information to really begin conversations and provide some sort of entry-level introductory information about best practices in adolescent-centered care. So you can feel free to contact us after this webinar if you have questions or ideas about how Sparks could work in your setting. And, you know, finally, maybe schedule one, and we'd love to know how it goes. We're excited to hear from people across the country about their experience. One of my favorite things I heard recently was from the Alabama campaign to prevent teen pregnancy, and one of their program managers contacted me and said, I found your Sparks last night and I used them in my staff meeting this morning. And that's really how easy they're meant to be. We want you to just be able to download them, a little bit of preparation, and put them into action. So additionally, we want to take a quick moment to tell you about the other resources that AHI has developed, all toward the goal of improving adolescent-centered care. So starter guides are mini toolkits that offer concrete, actionable steps to improve adolescent care. We have 9 guides available, including topics such as improving well visit rates, increasing chlamydia screening rates or HPV vaccination, establishing or enhancing collaborations between primary care providers and school-based health centers, and a number of other topics. For health centers, we've also created a number of resources that help providers and staff understand principles of adolescent-centered care, as well as posters that provide visual cues to patients that adolescents are a welcome and valued population. AHI's Teen Advisory Council has created a number of youth-driven videos for providers, parents, and patients, including topics such as teen self-advocacy, be your own healthcare advocate, voices of transgender adolescents in healthcare, and a video for parents on transition called Take the First Step Out of the Exam Room. We also provide technical assistance, coaching, and consulting on a number of different topics, and so if you have a need in your community, please feel free to reach out. And again, most of these resources are available just directly on our website, so we hope that you'll take advantage of them. Finally, we have a number of tools available for health centers to assess the adolescent friendliness of their sites. So these range from simple checklists to a youth-led assessment process where we sort of walk you through how you can engage a group of youth, whether or not you have an existing youth council or you want to identify some youth, but to provide their feedback on their experience at the health center. So different from a patient satisfaction survey, but really an opportunity for youth to kind of do a walkthrough and provide content that can then be delivered to health center leadership. We do have sort of some more in-depth quality improvement initiatives to help health centers become certified adolescent-centered environments. We've implemented this certification process with health centers in 13 states, the most recent of which are the ones highlighted in light blue. So if you're interested, feel free to reach out to us about learning more. And lastly, we wanted to let everyone know that registration for the 2018 conference on adolescent health is now open. We do have some additional sessions on brain development from Anna Suleiman, who's going to be with us for the Center on the Developing Adolescent. This annual event draws physicians, nurses, social workers, researchers, students, and public health professionals from across the country. And about half of the sessions at the conference are co-facilitated by youth collaborators, which provides real-time perspectives from youth on how providers and health professionals can improve adolescent-centered practices. Registration is open through April 6th. It's a great event, and we hope that you'll be able to join us. So thank you for participating in today's training on how you can use principles of adolescent brain development to enhance your approach to working with teens. You'll get a brief survey following this webinar, so please provide feedback and feel free to reach out to us if you need additional support. And at this time, we are going to take a few questions. If there are any kind of remaining thoughts or questions, please feel free to put them into the question box. And I did see a question earlier about can we get these slides? And yes, you will be getting a link to this recording, which will have this information. Is there a cost to downloading Sparks? There is not. Sparks are free and available for you to use, and we hope that you will. All right, are there any additional questions for today? Can you review quickly the aspects of a Spark? Yes, a Spark training is, like we said, it's meant to be delivered in 15 to 30 minutes in either a healthcare or a community organization setting. It's something where you will get a PowerPoint presentation, a script, handouts, and the kind of follow-up activities that we call sparklers. And they're on a number of different topics. And just as we did today, they're not intended to be incredibly in-depth and content-focused. They're really meant to sort of spark discussion and think about how this plays out in your setting or practice. And yes, this webinar will be available, the recording. It will be sent out to you in the next week. We have one question about, will any of the sessions from the conference be streamed? They will not, unfortunately. Can we share the Spark models in trainings we provide? Yes, please. We hope that you will. We hope that you will use them. If you need any modifications to Sparks, please reach out to us. So sometimes we will, like if we work with tribal communities or other groups, urban or rural settings, and someone says, you know, can we change the case scenarios to feel even more appropriate for our setting? Yes, please reach out to us. The templates for the Sparks are copyrighted by the University of Michigan, but we're more than happy to work with you to make some content changes so that it feels appropriate for your setting. And I think someone is asking about our other resources, so I think that is maybe getting at, are they free or can they be shared and used? So if you go on the Adolescent Health Initiative website, you will see all of our videos. Our posters can be downloaded directly. The Spark trainings are there. The starter guides are there. They are all ready for you to use. And like I said, if you have some requested modifications, please reach out to us. Great. Thank you so much. We appreciate everyone's time and interest. If you have follow-up questions, you'll have our contact information. Be more than happy to get at some of the more in-depth questions that are being asked right now on the question box. We can send you some additional resources. I want to say thank you again to Leslie Craig and to the Region 5 for helping us host this session.
Yes, thank you so much.